Hello, I'm Karen. I'm here at Haley Medical Aesthetic. Today I'd like to find out more about our therapy. So, well, as age catches up, the thing I'm most concerned is actually my sagging cheeks and also my nasolabial lines that's getting more and more obvious. And not to forget my double chin. So today I want to find out more from Dr. Tan. Hello, doctor. I'm Karen.
Hello, hi.
I'd like to
Nice
find out
meeting you.
more about our therapy, how it can help me with my sagging cheeks. I got more obvious nasolabial lines, and then of course my double chin.
Okay. Yeah, so anyway, very nice to see you, Karen. I'm Dr. Terence Tan from Haley, so just welcome. What you have told me is basically sagginess, right? So sagginess is age-related. It's also related to the sun, and it's a very common complaint. Under eye, sagginess of the cheeks, lines, even some loose skin over the double chin area. It's fairly common, and we see people with these concerns on a day-to-day basis. One thing that we do really often is our therapy. Okay, so I think you've already read up a little bit about our therapy. You know that it uses focused ultrasound, and it's concentrated in small dots deep underneath the skin or our skin to stimulate collagen. And when we have stimulation of collagen, we will have a natural lift. Our skin will become tighter. Hopefully, we will look much younger. And it's a very common procedure done. And it's one of the more famous non-invasive lifting procedures which tightens skin. It uses ultrasound. Of course, some people also use radio frequency, which is totally different, but also fairly effective. But for today, we'll really talk a little bit more about our therapy.
Okay.
It is US FDA approved, which means that a lot of research has gone into making sure that it is safe and effective. It's been around for quite a few years, but during this time, there's been improvements in terms of hardware, improvements in terms of software, and also, I guess most importantly, the company and practitioners have improved their techniques and the protocols. So for today, we are treating these areas. Okay, so your forehead area, the crow's feet area, the under eye area, the cheeks, and also the double chin area. So exactly all those areas that you tell me you're concerned about.
Yes.
Now there are two separate protocols. Okay, so if you see this picture, you see like they're almost lines like that, and these lines are really like a shot. Okay, so one shot is a focused ultrasound in a straight line, many dots, maybe about 25 to 27 dots, and all these dots will stimulate collagen. And previously, we used to use a 5.0 plus protocol, which means that we'll press our button 500 times, and over the areas that we talked about, there will be 500 lines or 500 shots. And while that is good, I always felt that we could do better. So recently, we have been doing the Amplify protocol. This is a protocol which has also been well studied in the US, and it's also approved to be used by the FDA. And instead of 500 lines, we have 800 lines.
Wow, okay.
So that means that we would do more.
Right.
The density of the dots and the lines are more, and therefore there will be more collagen stimulation. But more importantly, it's also safe because it's shown to have, doesn't show to have increased chance of side effects or complications.
Okay. Then is it painful because you said so many shots at one time?
Yeah, it is uncomfortable, whether it's 500 or 800 lines. So I think the most important thing we want to do is to prepare you properly. So as you know, today we've given some medication, put on some numbing cream.
Okay.
And as with any procedure, a good procedure needs good preparation, good execution, and good aftercare. Okay, so we shouldn't forget the preparation. So with the preparation, I'm pretty sure you'll be nice and comfortable.
Okay.
Yeah.
Then speaking about aftercare, so later after I'm done with my first session, can I go out straight away?
You may, because it's ultrasound based treatment, so it doesn't have any laser or light energy. So let's say if you do laser or light, typically we say please try to avoid the sun, But in this case, it's ultrasound, so you can do whatever you want. And yeah, there's no real aftercare. But the results do take some time. As you can see here, when we focus the ultrasound deep underneath the skin, we are not injecting anything. It's just really ultrasound. So it stimulates your body to produce collagen over various layers. The deepest part of the skin at 3 millimeters, as you can see here, and also a deeper layer called the SMARS layer at 4.5 millimeters. And because you're not injecting anything, we are kindly requesting your body to produce collagen. And the collagen which is produced by your body does take some time because the body tends to want to take its
So
time.
roughly how long would that be?
Yeah, so about 3 months before you see really good results.
Okay.
Some people even 4 months. So it's good in that it's non-invasive.
Yep.
There's no needles, no injections. It's good in that it's fairly effective and it's good for tightening, but it does take some time. So let's say if you do have an important event, in 1 week's time, it's probably not the best treatment for that. But let's say if you want to have a yearly refresh and anti-aging, want to look better for the long term, I think this is as good as almost anything else that we can provide.
So how many sessions do you think I'll need?
Okay, so for most people, we will ask them to come back once a year. So let's say you're going to do it today, you'll see your results maybe in about 3 months' time, and we'll ask you to come back 1 year for a refresh. But that's really just a ballpark figure. There's no real hard and fast rule. Some people want it a bit more frequent, some people want it a bit more sparse. That's okay.
Or it also depends on how fast my collagen production goes, right?
Well, not so much that, but more about how because in a year's time we are probably pretty different from what we are now. A year older, we have some more loose skin from sun exposure. So it's really a matter of how much loosening within this 1 year that we want to tolerate before we want to do another Ultherapy treatment.
I see.
But it's a very effective treatment, so you don't have to come back every month. You can just come back once in a fairly long
Yeah, I thought once a year sounds great because now regular facial is usually at least 3 weeks to a month like that.
Yeah, so this is a strong treatment, which requires a good preparation and a fairly long time to complete. But in response, or rather, in return, it is a very durable and effective treatment.
Okay, so how long is one session?
Depends. I mean, if we are doing a 800 line treatment, maybe about 1 to 1.5 hours.
Okay.
Yeah, so it is pretty long. Now, we talked about the Amplify protocol. So this is one of those things that we currently do, which is new. But recently, there's been another initiative by Ultherapy, specifically MERS, who produces this machine. And they've come up with this new treatment protocol called SPT, which means See, Plan, and Treat. Yeah. So as with what you said earlier on, the way we do the treatment is also constantly being improved. So in this case, what we have been trained to do by MERS is that we would pay particular attention to the ultrasound scanner that we see real time during the treatment. And there are certain guidelines for different people because different people have different thickness of their skin, their texture is different. Even within the same person, different areas are a little bit different. So we are taught and we actively try to customize the treatment and take into account differences between different people. And also within the same person, the differences within different areas of the skin to treat. So we will see, right? And then we'll plan, and then we'll treat.
Sounds great because it's at least customized to everyone.
Yeah, so we are improving all the time. And hopefully this time will be a really, really good treatment.
Okay, I'm excited to embark on it.
Do you have any other questions you want to ask me?
Well, I guess that's about what I wish to know already. Yeah.
Okay, that's great. So what we do is we will prepare you. We put some numbing cream.
Okay.
And then in a short time, we'll start the treatment.
All right. Thank you, doctor.
Okay, no problem. Okay, all right. So we're all prepared. We've washed your face, taken off the numbing cream.
Yeah.
And we're going to start the treatment right now, okay? So if you have looked at this, this is our therapy machine. It's a deep sea version, which is the newest version. We have got all these things, and these things are called transducers. And they come in various depths and all kinds of shapes and sizes. Some are longer, some are shorter, some are more superficial, some are deeper. So no matter where you do the treatment or where we do the treatment, there's always an applicator which is suitable. And that's why for us to be able to do SPT properly, we need to have a variety of different transducers. So this transducer will be put on your skin and it will scan the skin as well as effect the treatment. So the treatment ultrasound will go from the transducer to the skin, and at the same time the scan will go back into the transducer and will be shown on the screen, which I'll show you later on.
Okay.
Now let's talk about the protocols. You see, we have various protocols which are available here. So the old protocol is the 5.0 plus, but that's not what we're doing for you today. We're doing the better protocol, which is the Amplify protocol. And there we have it. Yeah. So without further ado, we start. Rebecca, can you just lie her down, please? Okay. So this is the machine. This is the handpiece, and we put the transducer into the handpiece like this. So this is, and once you do that, you'll be able to see this little window over here. So this little window is where we can see the ultrasound image of your skin, right? Of course, it doesn't show anything right now. And we're going to show you how your skin looks like. We'll put some gel on your cheeks first. Okay, and once you put gel and we put the transducer on, you should be able to see an image of your skin. Can you see that?
Yeah.
Okay, I'm just going to stop the scan. And if you can see over here, this white stuff here, that's the skin, okay?
Yeah.
The black stuff below the white stuff is the fat underneath the skin, the superficial fat. And this little thing which looks a bit dotty is the muscle. So the first layer we're treating is 4.5 millimeters, which is at just above the muscle, called the SMART layer. And the SMART layer is where your connective tissue is, which is also where you have most collagen. Okay, so we start with your cheeks right now. Yeah?
Okay.
Okay, put your head straight. Feels okay? Yeah.
Okay.
So you can hear the sound, so it tells us that we are firing, and it also tells us that which layer we are at. So every time before I press the button, I will always have a look at the ultrasound scanner, and only when the ultrasound scanner is shows me a good picture, that is, we are at the right place, and we are at the right level, and there is no there's good contact, then we press the button. Yeah? How does this feel?
Okay, like very tiny end bites, but not exactly painful. Yeah.
That's great. Yeah. So we'll continue this for quite some time, and 800 lines later, and you'll be done. So if you can see, Rebecca is holding a blower.
Mm.
This blower is good because it kind of cools down the skin. Not important for safety, but it makes a big difference in terms of comfort. So there are a few things that we do to make this treatment nice and comfortable. So number one is the numbing cream and medication. Number two, Rebecca is holding a cooler. Number three, we can also tune the power up and down a little bit. And science has shown that if you were to turn the power up and down a little bit, it shouldn't affect the treatment results very much. Unlike the number of lines, which is very, very important. So absolutely perfect. So, this is where the C-plan treat is pretty important because different people actually have different thickness of their skin, and nothing is as important as having the right thickness, right transducer for the forehead, because the forehead tends to have a bit thin skin, and we don't want a transducer which point past the skin onto the bone. But of course, I mean, it's not dangerous either, but it might be painful, and that definitely doesn't help. I mean, if you aim at the bone, what's the point, right?
Yeah.
So this is also the other good thing about using ultrasound, because you can literally see where you're treating. Can you see this thing here?
Yeah.
This line here. In nature, there are very few lines which are purely straight. So you know what is this thing here? The bone. Yeah, so it's skull. So this is the skin, and then there's hardly any fat, then there's the skull. So at 3.0 it's okay, but at 4.5 it will be on the skull already, so no point.
Much thinner.
Yeah, then the rest of and there's no fat, right? So it's just so it's also important for us to use technology properly to see. Otherwise, you have a powerful machine, but you just fail to use the features, so it's not going to happen. So we are at 240 lines. So congratulations, we are almost a third there. So if I ask you to describe the pain between 1 to 10, 1 being no pain and 10 being super painful, what number is this?
Sorry, which one is the highest again?
10. Lowest is 1.
Probably it's actually quite bearable, so I'll say maybe 4.
Wow, that's good.
Yeah. Hello, so I'm just done with my Ultherapy session. The whole process was actually very smooth. So doctor already prepared me to tell me that, if there's any pain to just signal to him. But I think it was good because pre-treatment, I was already with numbing cream and all. So the numbing cream actually has a cooling sensation, and I think that helps as well. And then when the treatment started, doctor was all the way assuring me. And when it started, I didn't feel it like very painful because of the numbing cream and everything kicked in. It feels like probably very slight and bites, but it's totally bearable. Even for more sensitive areas like the double chin area where we want to treat, it feels a little more intense, but I would say it's totally bearable. So after 1.5 hours, here I am, and I'm still looking forward to see results in 3 months' time.